In conclusion, I wanted to talk just a little bit about potential in terms of interventions. Ideally, I think it's important that we build on the resiliency factors that are there, because I would argue that my data really show that there is resiliency in this population, and that efforts to address both perceived and real experiences of racism and foster open communication regarding sexuality may actually ameliorate HIV infection rates by addressing psychological risk factors. There's a lot of data from other places that shows that depression, anxiety, et cetera, can contribute, can increase sexual risk-taking, can increase drug risk-taking. And so these associations have potentially very direct and important behavioral implications and potential implications for the future of the epidemic. Some of the things we plan to do in the future is to examine associations of these factors with risky behaviors, to look at intervention-related changes. Our intervention is designed to address some of these factors, so we hope we'll have some positive changes comparing the control and the intervention groups. And then to assess whether changes in such factors actually act as mediators for changes in risk behaviors. If we increase somebody's or reduce somebody's internalized homophobia, do they engage in more protective behaviors, for example? We have published a number of things related to these data. We also have a website, www.mailsproject.com. Those are the people who gave us funding, and this is very much a collaborative effort. We've worked with the Amasi Health and Cultural Center, JWCH, Palms Residential Care Facility, and Children's Hospital of Los Angeles. We've had many team members over the years. I'm really excited that many have moved on to bigger and better things, which is a good thing. And I just wanted to ask the team to stand up for a moment to thank them, because we have a really great team. And I wondered if people on the Mails team could stand up, Trista and Coley and Sean. And Dante, who is part of our team. I'm going to take questions now. I just want to share briefly, this is a picture from an HIV testing event that we've done. We've done 2 or 3 HIV testing events with Black barbershops in Los Angeles as a way of both sharing information about the study, but also building positive connections within venues that are not gay-identified venues, and they've both been very successful. So this is our picture from one.
Thank you, Dr. Harawa. Quick question. I'm wondering if can we make a distinction between secrecy and discretion? Because what I'm hearing is a kind of binary between full disclosure or public disclosure. And I'm not talking about identity, of course. And some people just don't talk about sex, or some people just don't talk about their sexual practices, but I'm not sure if that's the same as deciding to be secret. You see what I'm saying?
Yeah, and that sort of notion of privacy around sexuality, I think, expresses itself in different ways for African American men than is maybe discussed in the larger community enough. Yes, I think we can. I don't know if we have the best data for that. I mean, the question that I looked at specifically asked, how important is it for you to keep this a secret? And so that's what I focused on. I'm going to go back and look at the other questions. I don't think we have a good one that sort of maybe distinguishes it and puts it in like the realm of privacy, where I can maybe look at people who were distinct on those two. I am working on another study, though, where we tried to make that distinction in a better way.
Nina, I really enjoyed the presentation, and you did great after me. Come on now. This data is phenomenal, particularly the racism stuff, I think, which a lot of people have talked about, and then people make distinctions between perceived and experienced. Yeah. And I'm glad you said what you did about both, because I think at the end of the day, if you experience, whether it really happens or whether it impacts you because you've internalized it and you're expecting it to happen, the outcome can still be the same. I had a question about the data, and I have a theory about this, but I wanted to hear about yours. The number of incarcerations, and how the men that had more frequent incarcerations or longer term incarcerations were actually less stressed?
Yeah, so what we...
Yeah, how did you interpret that, or what did you think that was about? Because I thought that was...
Right in the middle.
I thought that was an interesting finding, and a lot of people would say that it's surprising, but I have theories about why it may not be surprising.
Yeah. I don't know that I have some theories too. They're really just theories. So this is actually number of times somebody was incarcerated. We also do have data on duration, but I didn't look at that here. Part of why I wanted to go back to these data and like control for things like age and stuff, I wanted to make sure, well, was it just that these folks were older, but that wasn't it. I'm feeling more and more that it seems like, especially in inner city communities, that incarceration becomes something of a normative experience for African American men, especially lower SES African American men, unfortunately. And so people who have had that experience, they've gone through something that maybe they fear, but at the same time, sort of everybody was a part of, so then they don't have that fear about it. And then also, I think for some people who maybe do experience sort of high levels of certain type of anxiety, they will make sure they're not incarcerated. They may like walk the straight and narrow in a different kind of way. I'm curious what your thoughts are.
The thing that I thought was, we're doing a study with heterosexual brothers in Georgia, in Atlanta, as well as Columbus and Valdosta, and we analyzed some of the qualitative data from 90 men that we interviewed. What we found was this whole cycle of recidivism and almost the process of being institutionalized. And a lot of the brothers were saying how less stressful it was for them to be in jail or in longer-term facilities, particularly prisons. And they really made a distinction between short-term jail and prison. And some of them say, in prison, I got cell phones, I got a 3-course meal, and then when they send me out, they don't give me shit. So I'm really stressed when I get out, and then I have to reacculturate myself with my family, my community, so on and so forth. So that would be my theory, because it's almost somewhat similar to, some of the data that people talk about with MSM and testing positive, and how it's like, oh, phew, I don't have to worry about it anymore. I don't have to I don't have to go through the anxiety of every unprotected sex act I have and go through testing every once in a while. It's almost like a relief. Some people have described it that when they test positive, they experience less stress. So I think it's kind of an interesting dynamic.
I actually thought, David, you were going to say that it might be because it provides a little structure. And that, except for the plus 21, at that point, maybe there's the realization that, it's really very hopeless. Or
maybe those folks are the ones who really are, dealing with severe mental, are more likely to be dealing with severe mental illness or something.
Which could be why they keep getting incarcerated, exactly.
Little question. One of the charts showed sexual orientation or defined sexual orientation, and you combined with self-identified DL brothers with heterosexuals. Why did you do that instead of making that a separate category or grouping them with bisexual?
Oh. So you're talking about this one?
Yes.
Well, why would you suggest moving them to bisexual? Well, because I think by definition, well, that's the wrong word probably too. It seems like if somebody's saying DL or heterosexual, they're not identifying with the same-sex part of their sexuality. They're not including that as part of their identity? Or though some people could argue the opposite.
I think in the common lexicon, the DL brothers are saying that I have sex with men and women, which would be close to the definition of bisexual as opposed to heterosexual. They might identify as heterosexual, but from a research standpoint, it seems to me that the comparable category might be bisexual as opposed to heterosexual.
Okay.
I don't know.
I got you. I mean,
it's not a big point, but.
No, I think it's, and we have even more categories, so some I didn't even include here. So part of it is you want to have groups that are big enough to look at some of the differences, but I think you make a decent argument why it maybe doesn't make sense to include them. Or I'd be a little afraid to put them in the bisexual group too, but I see your point.
I'd like to thank Dr. Herrera. Dr. Milbranch talked about earlier about family, and in
You're just going to have to project.
I can project.
Yeah, I know.
But if there was a such thing as a family, Nina would be my mother, John would be my father, and I would be their problem child. But I've learned a lot from them, and one of the things that no one actually touched on, and it was something that you made me very aware of in doing this research. We used the terminology behaviorally bisexual men, and a lot of presenters just said bisexual men. And when you helped us to look at behaviorally bisexual men, it wasn't how they identified, but it was their same-sex behavior. And when we were asked earlier this year, well actually last year, to do a panel on bisexual men, the great challenge was, so what is that? But when we talked about behaviorally bisexual men, we got categories even beyond what you have there as to why they even identified as bisexual, because it was about their behavior, not about their social identity. Could you?
Yeah, I agree. And well, I mean, I think you said that very well. I think too, I like that term a little bit better than MSMW, because now it's easy to start to get tripped up on the acronyms. And you know, if we were outside of HIV, they might have to parse it, but I think they can get what behaviorally bisexual means, but not necessarily the MSMW. So, but I think you've done a great job too of also talking about the people like in this homosexual group, which sometimes get forgotten. So, you know, we've encountered a fair number of men in our intervention who really think of themselves as homosexual, but may have sex with have sex with women because it might be in a circumstance where they can either get access to drugs or they can get access to a man they're attracted to because he will be more comfortable if there's a woman in the mix somewhere. So it's interesting. There's like a whole other dimension that I feel like has not been addressed a great deal. Thank you.
Okay. Thank you.